A study by the Hepatitis Foundation of Ghana has shown that there are more people living with the condition in northern Ghana. Director of the foundation, Theobald Owusu, wants persons diagnosed with the disease to avail themselves of proper medical care. He made this known during a screening exercise in Tamale organized in partnership with the Ghana Health Service to sensitize the populace and encourage them to adopt healthy lifestyles.
For the last decade, Ghana has seen a rise in cases of the deadly hepatitis B and C viruses, with experts calling for a national policy to help address the threat it poses to people. Globally, about 2 billion people are estimated to have been exposed to hepatitis B virus in particular, with almost 1/4 of them having a chronic infection. Here in the Techima municipality, health authorities at the Holy Family Hospital are engaging the services of special doctors to help educate the masses as well as offer specialist services to hepatitis B and C patients. Dr. Kofi Amoakun Obin Frimpong is a medical officer with the Department of Internal Medicine at the Holy Family Hospital. He says the high prevalence of hepatitis B in the area is worrying.
In our research, we saw that although it is spread across the various regions of Ghana, it is centered here. This is where hepatitis B is prevalent. And indeed, whenever we go for our mortality meetings at the end of the month, every time, we find out that people die from chronic liver disease, and most of them are from hepatitis B. And so we saw the need to actually conduct this screen to actually get the number of people who are positive here in Techiman, so that those who are negative, we know that hepatitis B is a potentially preventable disease. It's a vaccine preventable disease. We don't see why people should be dying from hepatitis B when there is a vaccine to prevent it, in the first place.
The facility, as part of activities to mark the World Hepatitis Day, held a free screening exercise to help provide early care to patients diagnosed of the disease.
So like I said, we want to screen the people. Those who are negative, we want to vaccinate them. And then those who are positive, after being positive, we'll conduct some other tests to see whether you need the drugs, or we may have to monitor you to the point you might need a drug.
Dr. Kofi Amoakun noted that the facility is intensifying its sensitization drive to help create more awareness across the area.
Indeed, this week has been a very busy week for the Department of Internal Medicine. We have gone to vantage points to inform them about hepatitis B. We've used other avenues like the radio station. We're at Gaskia FM. Another team was at Classic FM. We spoke in Chi, discussed the menace that hepatitis B can bring to the public if they are not screened and if they are not managed.
He was, however, quick to emphasize on the relevance of screening, adding that the safest way to stay away from being infected is through screening and getting vaccinated.
The primary preventive method is to screen. Screen yourself. If you are negative, we give you the vaccine, and you are supposed to take the vaccine for 3 times.
Some members of the public who are taking advantage of the screening exercise share with us what prompted them to participate in the exercise.
For me, I think it's important because, as I said in the beginning, for the screening, it helps to know your conditions with you. If you have a problem or everything is well to your system, you may not show any sign of the conditions, but you need to know that there are some conditions with you. So that if there are some hidden conditions in your body, the intervention can be taken as early as possible.
Chief of Takofiano and Atepem Hene of the Techiman traditional area and the host jurisdiction the exercise is currently taking place, urges the public to take screening exercises seriously in order to stay safe.
A future media massa Timanfoina answer. Mrebomi Yadian Ankasa. One way Yabakasa Bia Bobia. Nay, Diabo. And Tibia amount for Batisa announcement. Bia Amra, no Mefe, no Gem, no one said. So Bia Basano Man. So Nibusua, about one family, or the upon home by, say, Onyasaya Genevieve.
The free screening exercise forms part of a series of activities organized by the Holy Family Hospital to mark the World Hepatitis Day. Anna Sabit, Joy News, Techiman.